This is Sherman Lamb. He is a physical therapist at Kaiser in Vallejo. He attended Sacramento State University and went to University of Pacific for physical therapy school. He started working for Kaiser in 1997 and has been there ever since.
Trauma. Well, how I became a physical therapist is that I was an athlete in college, in junior college, and I got injured and I worked with an athletic trainer. Then I became an athletic trainer and worked with a lot of athletes and injuries. And then during that time I also worked in a physical therapy clinic as an aide, so I got to have both the rehabilitation aspect of physical therapy. So what I did is I learned that, became interested in that, and so I decided to go back to school and become a physical therapist. And then really I got interested in a lot of like rehabilitation things, and then also neurological injuries. So I ended up learning a lot of working in the hospital, people having surgery and post-injury trauma, and then I went into I worked into the rehab center, so people had stroke, spinal cord injuries, head injuries. So I worked in those for years, for like 10 years. And then I come back to orthopedics, which I did a lot of when I was as an athletic trainer. I think with physical therapists, I think the thing is they have a good people skills, so able to work with people pretty well and be empathetic and compassionate. Another thing, I think you have to have a very good analytical mind to actually work in this field to figure out what we're trying to do is looking at a problem and how to find a solution to it, if we can, or at least minimize the problem that a patient has. Another thing is that you have to have a lot of endurance too. Is another skill you have to, because it's a long day and able to work with patient, have manual skills. I think if you want to become a physical therapist, you have to have the traits that you want to be helping people, and then like I mentioned before, really think about how to help people. It would be like analytical mind. So I would think somebody who's interested in these type of things is really based on science and also helping people. And I think the way to do that is you should probably volunteer somewhere where you're helping in that type of field. So a good example would be volunteering in a hospital, or volunteering at a skilled nursing facility, or even an outpatient clinic to see what physical therapists do. That's what I would encourage, just to see what people do to help people. And then I think the biggest thing I would say is that if you don't have the interest in helping people and trying to make people better, I don't think it would be a good profession for you to pursue. I'm a supervisor, but I also do patient care. So what I do in a typical day is that I have to look at schedules, check messages, I triage orders, I do payroll, I do schedule changes, but patient complaints. That's what my first part of the day is. And then in the afternoons, I treat patients, and I run the post-op anterior cruciate ligament reconstruction group, or sports medicine knee group. So I see a lot of patients in rehab after they have surgery from sports injury. Nice and tight. Perfect. Perfect. Okay, let's see. Now let's see how far you can go. Bend your knee for me. Mama doing making you bend. Wow, that's very good. About 1/3. Wow. You're very proud of yourself. I know, it was hard. It was hard because I had a hard time working. I think the most enjoyable part of my job is working with people like you and Eliza all the time, and Anthony. I love to see patients improve and progress and able to return back to their activities and functional abilities. That's probably the best part of my job, is I'm helping somebody achieve a goal. That's what I really like to do.
Sherman's my physical therapist.
How long have you known him?
I know him 2 weeks after my surgery, which was January 25th.
And how would you describe him?
Sherman is a caring guy, but he will torture you until you're better.
Yeah, but when you really think it's not,
He's one of my co-workers, and also he's one of my bosses.
How long have you known Sherman?
I've known him I worked in this department for a year.
And how would you describe him?
He's very kind, he's very outgoing, and has a good sense of humor. But yes, he's a really good guy.
probably nothing. I think I've had really good experiences and really good mentors and teachers, and I think I wouldn't be here if I changed my path. I don't think I would. I think me changing my majors in college made me realize this was a great profession that would fit me. So I don't think I would really change it.